There's a lot of great deception going on right now. And to be quite frank with you, I was disturbed when I heard that a majority of African Americans are dying from COVID-19. And that was bothering to me. That was disturbing to my spirit. So I wanted to post these images because they assume immediately that if you're a certain age, you obviously have chronic diseases. But I did a post-mortem on a 92-year-old man a few years ago, a couple of years ago, I think it was. And I'm showing you, I'm starting with this lung first, because this man had the body of a 45-year-old person, muscular, built, the whole 9 yards. So I'm starting with this lung first to show you this is what a normal lung, even in a 25-year-old person, will look like. This is very normal, and I'm going to go down even closer so you can see that indeed this is very normal lung tissue. Beautiful histology, nicely preserved cells, and now the pathology that caused his death was indeed in the lung. And so I'm going to show you the next slide that shows bronchopneumonia, and even the third slide that I will be showing you shows a more intense pattern of pneumonia. But pneumonia invariably caused the death of a number of older persons. And I believe even in this epidemic, most of the persons are dying from preventable pneumonia. And remember, I talked about perhaps we should be giving these folk antibiotic early on in their disease manifestation. So I'm going to move this slide and go to the next slide, where I will be showing you the pathology in that particular lung. So on this next slide, as we peruse around to show you the gestalt of this lung, it's a little more congestive in this pattern here. But I'll show you pathology. Okay, that's nice bronchial epithelial cells. And if you live in a city, you're going to see scattered anthracotic pigmentation. It's just so normal because of the pollution in most cities. So, so as I peruse around, I'll show you the pathology when I get there. Well, so we don't waste a lot of time. Maybe just go on and find the pathology. Now, a lot of this is just collapse. I mean, obviously the person was dead, and so there was no aeration. Active aeration in the lungs, obviously, because of the patient was deceased. But I don't want to waste a lot of time. It may not be on this particular image here as I continue to peruse around, but we're going to show you a clear pattern of pneumonia that essentially caused his death. I mean, he was in a nursing home, and not because he needed to be, but only because of his age and not younger family members to take care of him. So, well, he didn't really need anybody to take care of him because he was very active all the way up to death. But I'm trying to show you the pattern of the bronchopneumonia. Okay, here we go. So that's clearly inflammation in a bronchus right there. You see that the abscess within his bronchus? Maybe a terminal bronchus, I can't tell. But anyway, I'm going to show you now where it's actually involving not only the bronchus, but also the alveolar spaces too, and that's classic pneumonia when you have abscess in alveolar spaces. So I'm going to go to the next slide. So now we're getting more into the alveolar channels, and you can see even as I quickly put the slide on, you start seeing pneumonia, which again is our abscess, neutrophilic abscess material, and that's quite clearly within alveolar spaces. I'm gonna see if I can go down. I may or may not be good. Let me see. Oh yeah, beautiful. So now you can see the polys, acute inflammatory cells, neutrophils, filling up alveolar spaces and channels as I continue to peruse around. No one will question that diagnosis there. That's clearly pneumonia in alveolar spaces. No matter how many times I push the slide around, you see that there is widespread involvement of abscess material within alveolar spaces. So he died from a pneumonia with sepsis, and I'm going to show you some of his other organs to show you that he was otherwise very normal in terms of anatomic structures of his organs. So here's a section of his coronary artery. You can see very widely patent, only minimal intimal thickening with atheromatous change, but you don't see that much in the way of calcified plaque material. So this man had the heart of a 25, 35-year-old man with a little, well, obviously 35, 40, because there's a little slight atheromatous change within the surface of the intimal component of the artery. But this is any person, 55, 65, 75, 85, will want a coronary artery that looks like this. Go to the next slide. So here's a section of his myocardium, left ventricular myocardium. Clearly, nice myocardial cells, no ischemic changes, no acute MI, perfectly normal. Let me see if I can go down to show you and highlight the histology of this perfectly normal heart and a 92-year-old man. No ischemic changes whatsoever, no inflammation to suggest any kind of acute MI, nothing of the nature. Very normal histology. A 25 or 35-year-old will want a heart that looks like this.